Have you ever noticed someone struggling to understand speech, even when sounds seem loud enough? Auditory Neuropathy Spectrum Disorder, often called a ANSD, presents with a unique set of symptoms that can make understanding speech challenging, even if sounds are clearly audible. Key indicators include difficulty understanding speech, especially in noisy environments, inconsistent responses to sounds, and sometimes, delayed speech development in children. Sounds might seem distorted or out of sync, making it hard to follow conversations. This happens because a ANSD isn't a problem with the outer or middle ear, or even necessarily with the volume of sound hitting the inner ear. Instead, it involves a disruption in the way the inner ear, specifically the hair cells, or the auditory nerve sends sound information to the brain. Think of it like a faulty electrical wire. The signal is there, but it's not transmitting clearly or consistently. The cochlea, which is the snail-shaped organ in your inner ear, might detect sounds normally, but the synchronized electrical signals needed for the brain to interpret those sounds are scrambled. This means sounds arrive at the brain disorganized, making it difficult to process speech accurately. If you or a loved one are experiencing these kinds of issues, especially if they are inconsistent, it is important to consult a hearing healthcare professional, like an audiologist. They can perform specialized tests that look beyond typical hearing loss, such as otoacoustic emissions and auditory brainstem response, to accurately diagnose a ANSD. These tests help determine how the inner ear and auditory nerve are functioning, providing clarity on the type and severity of the hearing challenge. One fascinating aspect of a ANSD is that traditional hearing tests, which measure how well you hear pure tones, might show normal or near normal hearing sensitivity. This is why it is often called a hidden hearing loss, as the problem lies not in detecting sound, but in processing the complex information within it, especially for speech. This unique characteristic often leads to a misdiagnosis or delayed identification, highlighting the importance of specialized testing. Understanding the symptoms of auditory neuropathy spectrum disorder is the first step towards finding effective management strategies. Recognizing these signs helps individuals and families seek the right diagnostic evaluations, leading to personalized support and interventions that can significantly improve communication and quality of life. Knowing what to look for empowers you to take action.